Ruthless Compassion is a podcast that shows you how to become fiercely kind. I'm the host, Dr. Marcia Sirota, and in each episode, I get into it with experts and regular folks about the things that get in the way of what we want. Things like addiction and mental health, isolation and loneliness, difficult family and work relationships, and the importance of self-care. I want to help you overcome the obstacles to living your best life, and I want to inspire you to become a powerful kindness warrior. Dr. Brian Goldman is an ER physician at Sinai Health in Toronto. He is also one of Canada's most trusted medical broadcasters. Since 2007, he has hosted White Coat, Black Art, an award-winning show on CBC Radio One about the patient experience in modern medical culture. Brian is the author of 3 Canadian best-selling books. His latest, The Power of Kindness, Why Empathy is Essential in Everyday Life, is Brian's search for empathy in an increasingly hostile world. Welcome, Dr. Brian Goldman, to the Ruthless Compassion podcast.
Pleasure to be here, Marcia.
I was just really excited to finish your book. I finished it over the weekend, and it really moved me a lot, especially at the end when you started talking about people with dementia and the way that people can deal with those with dementia, and how at the root of so many of their problems and their agitation are all these unresolved feelings and needs that they weren't able to articulate. And I that was very moving because, I don't think many of us think about people who have dementia in that way.
That was the eye-opener for me, meeting Naomi Feil and hearing about validation. She has an incredible depth of empathy, people who have dementia. And, you're quite right. Certainly in the past, I thought of people with dementia. If I didn't know them, I looked at the behavior, repeating phrases again and again, banging their hands on the side of a wheelchair or a walker, and knowing if there was any meaning behind what they were doing. I assumed it was meaningless, and I think most people did as well. If a patient, with dementia or a resident with dementia asked again and again, when is lunch going to be, you could see the annoyance by the people who care for them. And hear from Naomi Feil that there is actually a method. People who repeat the same phrases over and over again are actually trying to work through past traumas was a real eye-opener for me. And, every time I speak about it, talk about it, people respond to the book. It's an eye-opener for them as well.
Yeah, it's very moving. And I don't know what you'll think of this, but it reminds me a little bit of when people are dealing with their pets. And some people look at their pets and they just think that they're dumb animals and that their behaviors don't have meanings and the pets don't have feelings, but that actually their behaviors do have meanings and these animals do have feelings. And I think that when people are nonverbal and when animals are nonverbal, we decide that they don't really have any intentions, right? It's that ability to speak that makes us think that someone has intelligence and intention, but that's not necessarily the case, right?
Absolutely. And the thing about Naomi was she has such deep empathy for people with dementia. And you really do have to have your empathy circuits on maximum to be able to intuit, try to guess what is it. She developed a technique called validation. The idea is, metaphorically, instead of yanking people with dementia into our world where they're disoriented and they have no clue, they don't care who the prime minister is, who the president is, they don't care what day it is, they don't care that Bianca won the US Open because they can't relate to that. Instead, she encourages people who care for those who love people with dementia, care for them, to enter their world. And when you enter their world, you learn that they have this whole vibrant life. Now, it may be in the past, but you can travel to the past with them. Now, as Naomi said, you don't always, you use the techniques that she's developed. You don't always figure out what it is that they are revisiting, what traumas they might be revisiting or what times in their lives when they felt that they had a great sense of purpose and agency. But at the very least, at the end of it, they feel as if they have been validated. They are calmer. And if they're living in a long-term care facility, they're more apt to participate in daily activities. They're calmer, they sleep at night, and they're up during the day instead of sunsetting.
Such a wonderful thing. And it reminds me of what you were talking about in the book about how one of the aspects of empathy is taking the other person's perspective, right? Being able to walk in their shoes or look through their eyes. Could you talk a little bit more about the different types of empathy, like the cognitive and the emotional and all that?
So there are 3, broad components to empathy. And some have said there are 5 or 6. I think it's a little bit of splitting hairs, but the most important ones are cognitive empathy, which is the ability to imagine what it's like to be somebody else, to see things from their perspective. That is what's often lacking in healthcare. That's the thing that we want healthcare professionals, healthcare providers to have. For instance, what would it like? People are talking about hallway medicine and problem of hallway medicine, patients who belong in long-term care facilities who are occupying beds in acute care hospitals. And as a result, there aren't enough acute care beds, which means that patients remain on hallways in the emergency department. So that's a phenomenon that everybody's talking about. But what does it feel like to be a patient on a gurney in a hallway for 16 hours on average now, or perhaps even a day or 2 or 3 or 4? Sometimes the way to learn that is to get up on the stretcher and just feel what it's like. But if you start to imagine what it's like to be that patient, then the first thing you're going to recognize is that, hey, I got no privacy. If I need to go to the bathroom, there's 2 bathrooms in the corridors of the emergency department along the walls. And, I hear banging on the doors because people have to go. They have to go to the bathroom to relieve themselves, and somebody's been in there for 5 minutes. They also would discover that they are receiving all kinds of unwelcome smells and unwelcome sounds and unwelcome sights, and they can't block them out. And so that's cognitive empathy. Other kind of empathy that is up there with cognitive empathy is something called affective or emotional empathy. And that means feeling what the other person feels. And a lot of people who object to the idea that empathy is important, if you're a service provider, whether it's in healthcare or elsewhere, they immediately latch on to affective or emotional empathy and say, you had emotional empathy for all your patients. Well, what would that be like? That would be difficult. That would be terrible. And in fact, Helen Rice, who is a psychiatrist and also writes books about empathy, has referred to emotional empathy as emotional or affective quicksand. That's a very paralyzing thing. And, we don't want healthcare professionals to have an abundance of emotional empathy, because if they did, then if they depended on emotional empathy to motivate them, then they would probably be very motivated to help people who remind them of themselves, parents, patients who look like they could be their parents. And then they would not necessarily be empathetic for others who don't remind them of anybody in their lives. The third aspect of empathy is called compassionate empathy, sometimes called affective concern. And that is your motivation to help. Compassion is doing part of empathy. So if you have that perspective of what it's like to be somebody else and you're motivated to help them, then that's called compassionate empathy. And we certainly want service providers of all kinds to have that in abundance. And that is often lacking in healthcare. That's certainly the area that I know more about, but it's lacking in lots of areas of service, customer service.
Why do you think we're having such a problem with empathy these days? Or I'm making an assumption that we're having a problem with empathy these days. First of all, do you think we are? And if so, why?
I certainly do. I wouldn't have written a book about empathy if I didn't think we had a problem with empathy, a challenge with empathy. Now, we are, of course, the good news is that we're all, unless you're a psychopath or a narcissist or a Machiavellian, we are all hardwired to be empathic. It's pro-social. Evolution has guided us towards being more empathic so that we build societies, we help one another, we have a sense of community. But we have an override, and that is if we're under stress, for instance, we have this other tendency. If the psychologists tell us that if we're shown a photograph of somebody, within a few nanoseconds, we decide whether that person is a member of our group or the out group, another group. In other words, are they us or are they them? And that's there as well. So why don't we kill each other? Well, we don't kill each other because we have these great giant frontal lobes and we have executive function. And executive function allows us to say, that's crazy. I just looked at that person and I assumed they're a bad person. Oh, if I get to know them, I'm going to realize that we have more in common than we have different. And so that's great, except that we lose that ability to override that us and them kind of instinctive tendency when we're under stress. And if you look at different societies, for instance, in the United States, there's been a lot, they seem to be going through the rise of us and them. Certainly it is heralded by the arrival of President Donald Trump. Now, I don't think Donald Trump has caused it, but I think he's exploiting it. And, when he or somebody else stands up and says, look at those refugees or those immigrants, they're taking your jobs away, they're taking your security away, they're bringing drugs across the border, he's appealing to that instinctive tendency. But why are people listening? People are listening because they're under stress, and the stress comes from job insecurity, housing insecurity, about borders and fear. And so the way to try to neutralize that problem is to address the fundamental reasons why Americans are so insecure these days. And, it's not just their attitude. Rising drug use, substance use would be another manifestation of that issue. And all of these are leading to a lack of empathy. There are other factors. I think social media is leading us to think that we're having deep and meaningful relationships online when you don't. And there's been a generation by generation decrease in personal friendship and that one-on-one, those deep relationships that come from sitting with somebody for hours at a time and talking with them about everything. And that's the kind of thing that people are missing these days. And, they think that, if they get lots of likes on Instagram, that means that they feel good about themselves, but they don't. So that's another factor that's contributing to a lack of empathy. Another one that I think a lot of people don't talk about, but I think is pretty pervasive in healthcare. I think a lot of healthcare professionals are prone to shame, and they may not know it, but certainly if they make a medical mistake, and that's something that I've both studied and I have some personal experience with, but we all do. We're all human. But I have certainly gone through the process of reacting to my own personal mistakes and feeling a sense of shame. And as Brene Brown writes in all of her books, the latest one is Dare to Lead, shame proneness blocks empathy, and it's pretty pervasive. It blocks empathy because, when you are ashamed of yourself, you don't want to be discovered. You don't want to reveal yourself to others. You're terrified that your mistakes will be discovered. And what you want is for a hole to open up in the earth and swallow you up. In that state of mind, it's almost impossible to be empathic to others.
I think these are excellent points that you're making, and especially the one about shame, because it is quite unknown, but it makes such perfect sense when you say it.
Yeah. And a lot of people don't know it. In healthcare, not everybody makes a terrible mistake, or the mistake is caught. It doesn't turn into a horrible injury to a patient that scars that family forever. And so they may never have to confront this. This is just my intuitive guess, but I think a lot of healthcare professionals are relatively shame prone, and they go into the health professions to try to do enough good deeds to assuage their bad feelings about themselves. I can't prove that. There's not a lot of literature on healthcare professionals and shame. We're now starting to see that. There is kind of a huge literature on shame in the psychology literature, but not among health professionals. But now, thanks to researchers such as Diane Oban and Dr. Will Bynum in the United States, we're starting to see the first articles that are looking at shame proneness among medical students and residents. And we know that residents and medical students these days have high rates of burnout, high rates of depression, and even suicidal thoughts. And this reminds me that another factor in reduced empathy among healthcare providers is burnout. And that burnout comes from compassion fatigue, which is what happens when you are exposed repeatedly to the traumas of your patient. And of course, that's part and parcel with being a healthcare provider. For that patient and their family, it may be first the one and only time that they receive devastating news from the healthcare provider. And to the healthcare provider, it might be the 200th time they've had that conversation in the last year. And so compassion fatigue is a factor that leads to burnout. And there are studies that show that the higher your burnout scores on standardized testing, the lower your empathy scores on standardized testing. Those are some of the factors that are responsible for a lack of empathy amongst healthcare providers.
So what do you think is causing the lack of empathy among the average Joe on the street?
I think they're self-preoccupied. I think they're anxious. There's a lot of free-floating anxiety in our world, and it's anxiety about everything from climate change to, do I have enough friends? Am I missing out? Fear of missing out. I think that we used to be able to push away bad news about the world, about the economy, about housing, about climate change. And now, because of social media, because of smartphones, it's in our faces constantly. I think those are some of the reasons. Certainly, we have seen generation upon, after generation, higher rates of anxiety in teenagers and college-age students. So none of this surprises me. I think these are the factors that can lead to increased anxiety and therefore decreased empathy. And I say that, the two, it may not be intuitively obvious that the two fit together, but the more anxious you are, the more preoccupied you are with yourself. It is very difficult to be focused on somebody else's distress when you're focused on your own distress primarily, when your own distress is so overwhelming that you find it difficult to tune into the distress of others.
Yeah, that makes perfect sense, actually. And I absolutely have noticed the skyrocketing rates of anxiety among young people both in my personal and my professional life. And it's quite horrifying, actually.
Yeah. And we don't know where it's going to lead. It seems, we see manifestations of this all the time. We're talking in the news today about teens vaping. And I first started to hear about this from parents in the last couple of years. And vaping of nicotine is an excellent substitute for cigarette smoking in experienced hardcore smokers, 1-2 pack-a-day smokers, and it reduces their risk of lung cancer and chronic obstructive pulmonary disease. So that's all good. But when vaping became legal, there were supposed to be controls put in place to make sure that teenagers didn't have access to vaping. Well, it turns out they're buying it at a convenience store. That's a bad thing. But we also have to take a step back and ask the question, why are more teens vaping? Well, I think they're using substances partly to deal with their anxiety about modern life. And that's one of the reasons why they're using marijuana and why they're at risk of moving on to harder drugs. So all of these are manifestations of this space of anxiety among students. And, we can ask, why is there so much anxiety? I've talked about social media. There was a fascinating 20-year experiment that's been going on in Iceland right now. Iceland had the highest rate of teen drinking in the world. Every Friday and Saturday night, teens would pour into the central square in Iceland, in Reykjavik, the capital. They would binge drink until they passed out, and many of them were brought to the police. They would spend the night in jail, and when the police called their parents had no idea where they were and who they were with. And so social scientists in Iceland developed a program called Planet Youth. They crunched the numbers and they discovered that there are two factors that distinguish the teenagers who didn't get intoxicated with the ones who did. The first was that their parents were directly involved in their lives. They were with them every day. They had at least one meal. They shared lots of time together. And it wasn't what we call, quote unquote, quality time. It was just mundane time, spending time hanging out together, maybe watching TV together and having at least one meal a day together. The second factor was that they were involved in after-school programs. And so they developed a program that's now called Planet Youth, where parents signed a soft contract to spend a certain amount of time with their kids each day. The government spent a lot of money increasing the amount of funds that were available for after-school programs for kids, and they had a soft curfew so that kids who were, say, 10 years of age needed to be home by 8 o'clock, and kids who were older needed to be home by 10 o'clock at night during the school year. And they also had parental patrol, so they patrolled the neighborhoods, and if they found kids who were out past curfew, they would send them home. Well, they went within a couple of years from having the highest teen drinking rates in the European Union to the lowest. And now they're exporting the model to several countries, including Canada, which is beginning to take an interest in Planet Youth.
That's amazing. That's so smart. But again, this is a sign of empathy because even the government is empathetic. They're caring about their youth and they're caring about their families. And so they're willing to spend money to implement this program.
Yeah. And isn't it telling that in Canada, we're more concerned about our budgets and budget deficits? And that's, sometimes governments take a short-term view. If they take a longer-term view, they realize that every dollar they spend today on, for instance, early childhood education, teaching health literacy, making sure that parents are well supported, addressing social determinants of health, pays huge dividends down the road in decreasing morbidity and even mortality, reducing mental health problems among adults, and undoubtedly reducing hospitalization and other health effects in our society.
Absolutely. No arguments from me on that. So let me ask you a question. So you wrote this book, The Power of Kindness, Why Empathy is Essential in Everyday Life. And as I said, I read it and I enjoyed it thoroughly. In the book, you talk about how you started writing this book, and it was because of your own self-reflection. Can you say a little bit more about that?
Yeah, there was one case in particular. I saw a woman in the end stages of a degenerative neurological disease, and her family, and she'd reached the point where she could no longer speak for herself. She couldn't care for herself. Her family was spending a lot of time caring for her. And like a lot of families, when they have a loved one who is who is approaching, the final months or perhaps year or so of their lives, they're increasingly uncertain if they're doing the right thing caring for them at home. And so they brought her to the emergency department. Because she wasn't acutely ill, I did refer her to the internal medicine team, but it took hours for them to see her. And every time I walked by the room, they asked, when's my mother going to get a bed? And I would say when she sees the internist. When will my mother see the internist? And they kept asking these questions. And at one point I did something very uncharacteristic. I snapped at them. And I didn't yell at them. I said, I did what you asked. And I sounded very defensive when I did. And the husband of the woman eventually wrote a letter to me accusing me of unkindness. And I felt I couldn't ignore it. And so that's what ignited me to look at myself and look at empathy in healthcare. I soon discovered that I wasn't the only one, that lots of healthcare providers, for the reasons we've talked about, are not particularly giving when it comes to empathy. So I looked at the reasons in healthcare and, things like stress, time pressure, technology, fragmentation, lack of adequate supports. But interestingly, I had originally pitched a book on empathy or lack of empathy in healthcare, and my publisher HarperCollins wisely suggested that I broaden my horizons, that is, and go looking for empathy in the rest of the world. And so I did, and that's how the book came about.
Well, I feel like when I read the book, I kind of got to know you a little bit because you were so honest about your own personal journey. And I think it's so important as a healthcare provider, because we doctors and healthcare people, it's very hard for us to admit our frailties, our failures, our flaws. And I think, that perpetuates the shame. And then, of course, it makes the empathy less possible, right?
That's right. And the only way, and, I kind of discovered, in midlife, and I was very defensive, sensitive to criticism. And, I was really focused on not being discovered as a flawed human being. And one day in desperation, I realized that, errors, I could either learn from my mistakes and find a different way of dealing with my own mistakes, or I could be paralyzed by my own mistakes and perhaps even quit the profession. And I discovered, reading Brene Brown and other authors and learning about shame, that the antidote to being shame prone is to talk about the things you're ashamed of. In other words, be vulnerable. So you risk vulnerability. And my message to healthcare professionals and to people who don't work in healthcare is find somebody you trust, somebody who will empathize with you, and unburden yourself. And that person who listens to you, they have to see you as you are and accept you as you are, and hopefully say, yep, the same kind of thing happened to me, and here's when it happened, and so that they share. And what I've discovered, as Brene Brown has taught, if you talk about your mistakes, you end the silence. And silence is what allows shame to marinate. If you talk about what you are ashamed of, then the shame dies. It loses its power to enslave you. And that's the most important message in the book. And it's funny because I never even said it in the book, but that was the most important message.
Well, the message I got right at the end when you talked about your epiphany is how important it is to have self-compassion first. Could you say a little bit more about that?
Yeah. I think that, for instance, in healthcare, and I talk a lot about healthcare because I am a healthcare provider, I've seen far too many colleagues, and including myself, who give it all to their patients, and then they've got nothing left for themselves, and they wonder why they resent the job, 20 years in, why they hate it, why they burn out. So the first person you have to be compassionate to is yourself. You have to forgive yourself. You have to like yourself. And by the way, if you're shame prone, it's very hard to like yourself. But you have to discover yourself to be able to do that. Be mindful. You have to entertain your worst thoughts. Let them happen. Let them float by. You have to indulge yourself by by practicing mindfulness, by taking care of your body, by not going for quick fixes like caffeine and other substances, by meditating or whatever it is that allows you to get to that state of calm. For me, I do breathing exercises. When I need it, and when I need, when I really need a fix to assuage this agitation, this kind of itchy agitation on my soul, I go for a long run, because that's my go-to. Because at the end of the run, I feel a lot better about myself, and I feel like I've exercised, burned off a lot of that energy. But you have to practice self-care first, or you will not be available. You'll have no empathy left for other people.
And I think that line bears repeating. You have to take care of yourself first, and because otherwise you won't have anything to give to others. I really think that is such an important message for all of us, not just healthcare professionals.
Yeah. What's the warning on airplanes when the oxygen mask drops? Put your own oxygen mask on first before helping somebody else.
Exactly. Because if you're out of breath, you can't do anything for anyone else. Exactly. So in your book, you have an interesting call to action about, find somebody that you can't stand and do something kind for them. And because they don't expect it, and that will create empathy in them. But I'm just wondering, do you have a different call to action today that you might want to encourage the listeners to consider?
Yeah, I think that make an exercise of finding and meeting a new person and find one thing you have in common with that person. Politicians are preternaturally excellent at this, and the ones who have the gift, the populist gift, the ability to connect with others, it's because they find things that they have in common. That we share 97.5% or 97.3% of the same genome as orangutans in Borneo, who are magnificent creatures, by the way, in their natural habitat. If we share that much in common with orangutans, then the differences between individual human beings, wherever they come from, whatever culture they come from, are vanishingly small. And we are stronger when we recognize what we have in common instead of magnifying our minute differences.
So really, instead of us and them, really feeling that sense of usness.
That's exactly right. Getting to us, going from them to us is really the royal road to getting along in this world and increasing empathy and reducing, the stress and agitation that's been going on lately. Very
nice. So can you let us know where to find you and what interesting projects you're working on these days?
Well, I'm continuing to host White Coat Black Art on CBC Radio One. It's a show about the patient experience in the culture of modern medicine. And our website is cbc.ca/whitecoat, one word. You can find out all about me at drbriangoldman.com. That's DOCTOR Brian, BRIAN.com. No spaces between. And you can find my books at Indigo. You can find my books on Amazon.ca, Amazon.com, and around the world. And I'm on Twitter at NightShiftMD, all one word.
At NightShiftMD. Great. Well, it's really been a pleasure talking to you today. I think this theme of kindness and empathy and compassion is so, so important. And we're living in divisive times, but whenever somebody is talking about connecting and coming back to us, I think we really need to give these people a voice and give you a voice, because the message is so, so essential right now, as you say.
Which is why it was a great pleasure to speak with you, because I love talking about kindness and empathy.
Well, thank you so much again. Have a great day.
You too.
That was the terrific Dr. Brian Goldman, and I'm Dr. Marcia Sirota. If you like this podcast, please review it on iTunes, and you can sign up for my free monthly wellness newsletter at marciasirotamd.com, where you'll also learn about my new online course about dealing with difficult people.